Hi, welcome to another knee moment from Knee Fit in 5 and MSM products. My name is Dr. Matt Lawless. The first question comes to me from a man named Bill who says, "Hi, I'm a 60-year-old male and was recently told by my surgeon that I had knee arthritis. I went for some mild knee pain. It wasn't really limiting activity, but was getting somewhat worse, and I was concerned. The surgeon I went to took x-rays and told me I had some mild arthritis and suggested that I start taking an anti-inflammatory and stop running. What is your advice?" That's an interesting question, Bill. I usually give the advice of the exact opposite. I say that long distance running and continuing jogging is good for a knee and healthy for a knee and does not further advance knee arthritis. In fact, there is a 2008 article in the American Journal of Preventive Medicine that studied just that, long distance running in patients with knee osteoarthritis. What they did is they followed runners and non-runners who were 45 years old or older and had been diagnosed with arthritis. What they found was that the ones that had the arthritis did better with less worsening of their knee arthritis than the people that didn't run. And they followed them for over 20 years. So what that tells me is that running by itself is not a risk factor for knee arthritis. In fact, it helps people with knee arthritis prevent their symptoms from worsening, helps them to be more functional, and probably prevents worsening of their disease more so than if they weren't running at all. So my advice to you, Bill, get out, continue running. Yes, arthritis does cause some knee soreness. Try not to limp, try to walk normally, keep your motion, keep your strength, and keep pounding the pavement. And thanks for writing in. If you liked this video and found it informative and would like to have further information, please check out our YouTube channel as we have many informative videos there. Please also subscribe to our video channel and you'll get weekly updates with new information.